We're a department of 6 physicians right now who specialize in diseases of the lung and disease of the critically ill. So we run the medical ICU, as well as we have an inpatient admitting service for primarily lung patients, a consult service where we consult on inpatients that have lung problems and secondary issues, as well as outpatient clinic.
So our outpatient practice is busy and specialized, and we serve as a referral clinic for our colleagues elsewhere in the network. Sleep services also are really robust and doing high-level care and studies. And then the medical ICU work, we take care of the sickest patients in the network. We sort of pride ourselves as being the ones who take care of folks that no one else can take care of. We really see ourselves as sort of a safety net in a lot of ways with respect to clinical care.
We have a brand new ICU. It's very modern, and we're sort of adding different technological advancements as we can. Pulmonary and critical care has become a very popular field for trainees. So we actually get upwards of 350 applicants for our 2 spots. So just from a numeric standpoint, it's extremely competitive.
When people come and interview here, they get a sense of sort of who we are and how much we care for the fellows and how much we invest in the fellows. There's a lot of nurturing and there's a lot of support, that plays out over the 3 years.
We've had a 100% pass rate for the last 3 years in terms of pulmonary and critical care boards. And we've placed our graduates in very large programs after they've finished here. So people are noticing what we're doing here.
St. Elizabeth's is a unique place. It's a tertiary care hospital here in Boston, and it recruits and pulls from all of the great institutions in the city. But we do it at a smaller scale, which allows us to, I would argue, sort of take things on a more personal level with respect to care delivery with any particular patient. And I think it also allows us to form really strong relationships with our colleagues from other divisions and departments.
I remember when I first came to St. Elizabeth's, I was giving a grand rounds lecture before I even had started. And I was walking around the hospital trying to figure out where I was going, and people stop me and say, "Hey, you're the new pulmonologist." And I come from a very, very large institution where nobody knew me after I was there for a decade. And so that's a very nice feeling.